Hi guys, I'm Dr. Paresis and welcome to another video. In this video, I thought I'd take you through a patient's case that I found very interesting. And it was a gentleman that actually came to us in our New York clinic. He came to us with a very specific request. So let's take a look at the before photos. You can see this is a gentleman in his mid to late 50s with a very classical Norwood 4 to 5 pattern of loss. He had tried using medications to stabilize his loss, had managed to slow things down, but wasn't quite able to restore what he had lost. But he came to us with a concern he had. Understandably, he had looked at some results from other clinics and was concerned about not being able to get the hair volume that he wanted from a hair transplant. Now, we always shoot for as much volume as possible for every patient that we perform a hair transplant on, but this case did take a little bit more of a nuanced approach. The good thing is when patients know how they want to style their hair after their hair transplant, it gives us a lot of information and it allows us to modify our surgical approach. We're able to change things like the angulation and directionality to suit their hairstyle. Now, when patients want to slick their hair back and achieve more volume, we can increase the angulation of the hairs so that the hairs exit the scalp more at an obtuse angle. It can be technically more challenging to place grafts in at a different angle, but when it works out, it does give the appearance of higher density, more voluminous hair. And this is thanks to the layering effect of those transplants layering on top of each other because of their new angle that just helps so much. And you can see in the after photos here that we were able to achieve this for this patient. Look at that brilliant poof of hair in place where there was literally no hair before at all. Look at how the patient is able to blend it with the native hair behind. And you'll note that the patient appears to have a little bit more of a spring in his step, in the after photos at least, as well, which is something we see often when we're able to deliver good results. I certainly had much more of a spring in my step and still do after my own hair transplant. You can see here, I had a hair transplant nearly 4 years ago now that I'm very happy with. The last photo here is just of Dr. Bloxham showing that 2mm linear FUT scar that the patient is able to hide so easily. And should he want even more density in the future or more volume in the future, we're able to go in there and take more from that donor area that is currently completely untouched because he went for strip surgery to begin with. Thank you guys for watching.